Ladies and gentlemen, thank you for joining MPRO's using client reminder systems to increase cancer screenings. Your host for today, Elise Dion, will begin.
Thank you. Good morning, good afternoon, and welcome to today's webinar. This event is part of our Michigan Cancer Control Initiative, which aims to improve cancer screening rates throughout Michigan. If you'd like to learn more, please visit cancercontrol.mpro.org. If you'd like to download a copy of today's slides, they will be uploaded to our website. And again, that's cancercontrol.mpro.org. Today's speakers are Julie Campbell, Quality Consultant with MPRO, and Tisha Looper, Quality Program Manager with MPRO. Participants can feel free to submit questions via the chat box at any time during the presentation. If you hear something that your practice currently does around client reminders or has done in the past and would like to provide insight, please submit your comment in the chat box, and Tisha or Julie will address it as soon as possible. At this time, I'd like to turn it over to Julie.
Great. Hi, everyone. And like Elise said, thank you for joining us this afternoon. Today, we're going to be talking about using client reminders to increase screening completion for colorectal, breast, and cervical cancers. So first of all, for those of you who aren't familiar with MPRO, we're a nonprofit quality improvement organization based out of Farmington Hills, Michigan, and we provide healthcare consulting and review services as well as data analysis services to federal agencies, state Medicaid and public health organizations, healthcare facilities, and private health plans, and also other third-party payers. MPRO also represents Michigan in the Lake Superior Quality Innovation Network, which also serves Minnesota and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization program. So with that introduction, we'll go ahead and jump right in. So to kind of frame our discussion before we get started, we're first going to talk about trends in current prevalence of cancer screening in Michigan, beginning with colorectal cancer. So colorectal cancer is the third leading cause of cancer-related deaths in Michigan for both men and women. And over half of CRC cases are diagnosed at a regional or distant stage, where we know that treatment is more likely to be successful when cases are diagnosed earlier. We're also seeing increasing numbers of colorectal cancer cases diagnosed in individuals before the age of 50. Throughout the past few decades, the number of new cases and deaths from colorectal cancer has decreased, but both of these numbers are still remaining higher in African American men and women when compared with white men and women. For breast cancer is the most common newly diagnosed cancer in Michigan women and the second leading cause of cancer-related deaths in this population. More than 50% of breast cancer cases are diagnosed at localized stages, when 5-year survival is close to 100%. So again, the number of new cases and deaths associated with breast cancer is showing a decreasing trend, but again, this remains higher in African American women compared to white women. For cervical cancer, the American Cancer Society estimates that about 370 Michigan women will be diagnosed with cervical cancer, and around 110 women will die of cervical cancer in the year 2017. However, an encouraging percentage, 93% of cervical cancers can be prevented with regular screening and utilization of the human papillomavirus vaccination. So like we saw in colorectal and breast cancers, while number of new cases and deaths associated with cervical cancer are decreasing, they still remain high in African American women, which is important to bear in mind as we talk through this intervention today to increase screening rates so that we can be sure that we're targeting patients in need of services and also working to eliminate health disparities. So now that we've talked about trends in incidence and mortality associated with these cancers, we also want to talk more about where we are as far as screening, and again, those who might be getting left behind in completing the screening process. So this data here on the slide is taken from the 2015 Behavioral Risk Factor Survey annual report, which shows that 56.5% of Michigan adults ages 50 and older reported having a sigmoidoscopy or colonoscopy within the last 5 years, and 71.8% reported having an appropriate colorectal cancer screening test. So this is going to include the yearly fecal occult blood test, sigmoidoscopy within the last 5 years, or colonoscopy within the last 10 years. This percentage has increased over the years, and we're still working on pushing that further. There's actually a national campaign led by the National Colorectal Cancer Roundtable to have 80% of adults 50 and older regularly screened for CRC by 2018. So as a state, we're definitely on the right track, but we also have a little bit more work to do. The prevalence of appropriate colorectal cancer screening in Michigan was also similar by gender and race ethnicity, but increased with household income level. And those with insurance were more likely than uninsured to have reported receiving appropriate colorectal cancer screening, about 73% versus 47% respectively. So here, again, are disparities in certain vulnerable populations, and we'll see this also in breast and cervical cancer screening. So for breast cancer, also from the Behavioral Risk Factors Survey, nearly 76% of Michigan women 40 years and older reported having a mammogram within the past 2 years, while about 48% reported having both a clinical breast exam and a mammogram within the past year. As with colorectal cancer, breast cancer screening measures increased with household income, but were similar by race and ethnicity, and insured adults were more likely than uninsured adults to have reported receiving a mammogram within the past 2 years, and that was about 78% versus 44% respectively. So overall, numbers are looking pretty good for Michigan women having recommended screening, although Healthy People 2020 has set a target of about 81% of women to be screened. So that gives us just a few more years to reach this goal in Michigan. For cervical cancer screening, nearly 89% of women in Michigan ages 18 and older reported having a Pap test, while about 75% reported having the recommended Pap within the last 3 years. And again, Healthy People 2020 has set a target of 93% of women 18 and older being appropriately screened. So like breast cancer screenings, we're close with this, with just a little bit more room to improve. The prevalence of appropriate cervical cancer screening increased with age, with the exception of women who are 70 years and older, which makes sense in the context of screening recommendations. And again, the data shows that prevalence of appropriate cervical cancer screening was similar by race and ethnicity, but also increased with household income level, and that insured women were more likely to report appropriate cervical cancer screening than uninsured women. And that was about 77% versus 56% in this case. So now that we have talked about where we stand as a state on incidence and screening rates, we also want to briefly discuss what's being done to move us forward on increasing screening and reducing health disparities related to cancer. So on the state level, and with guidance from the Michigan Cancer Consortium, experts from over 100 Michigan organizations came together to develop a guide for addressing the burden of cancer in our state. And this is the Cancer Plan for Michigan 2016 through 2020. Actions in the guide are based in scientific research and include goals with specific objectives and strategies for how any individual or organization can contribute to cancer control in Michigan. The plan also addresses all parts of the cancer journey. There are goals for prevention, early detection, diagnosis and treatment, as well as survivorship and quality of life. It also contains focus areas in policy, systems, environmental change, health equity, developing partnerships, and also evaluation in order to measure outcomes. So this is a great resource that I definitely recommend reading through. And then we'll also take a look at a couple of other resources from the Michigan Cancer Consortium in the next slide. So from MPRO's perspective, MPRO is a grantee of the CDC and MDHHS Comprehensive Cancer Control Program. And we've been working since 2015 on project components in the areas of breast and cervical cancer prevention and screening, which is wrapping up at the end of this month, as well as colorectal and lung cancer prevention and screening, which both continue through the fall of next year. So for these projects, we offer free assistance to primary care practices in Michigan to implement evidence-based interventions in order to increase cancer screening rates and also monitor data on a quarterly basis to see how the implemented activities are moving the numbers. So for practices that are involved in the project, we have set goals of 10% improvement in colorectal and lung cancer screenings and 5% improvement in breast and cervical cancer screenings, as well as tobacco use screenings and cessation counseling throughout the course of project enrollment. And enrollment is still open for the colorectal and lung cancer screening components. So if you are interested in more information or enrolling your practice, please visit the link at the bottom of this slide. One of the best practices that MPRO has been working on with offices is having documented cancer screening protocols. So these protocols also frame our conversations for the patients that we're going to be targeting with client reminders like we're talking about today. And you don't have to start from scratch on documentation like this. So in the next few slides, we're going to highlight some great clinical protocol resources put together by the Michigan Cancer Consortium, or MCC, the advisory committees, which are based in screening guidelines from the U.S. Preventative Services Task Force, as well as the American Cancer Society and the National Comprehensive Cancer Network. So here on the slide for colorectal cancer screening, the clinical protocol breaks down recommendations for average, increased risk, and high-risk patients for colorectal cancer. So for the average risk patients, it's recommended that women and men ages 50 to 75 are receiving one of the following tests. So the GFOBT, the fecal occult blood test annually, the FIT, the fecal immunochemical test annually, DNA FIT is recommended every 3 years, colonoscopy every 10, flexible sigmoidoscopy every 5, and then CT colonography also every 5 years. So for breast cancer, the protocol here, I'm just going to kind of highlight the average and increased risk recommendations. So it's recommended to begin annual mammograms in women at the age of 40. And then kind of based on the organization that's making the recommendations, women from about age 50 to 55 all the way up to 74 years, it's recommended an annual or every other year mammogram. And then in that population of women kind of before age 40 where mammograms are recommended, a clinical breast exam every 3 years by a health professional for women ages 20 to 39. This is also, it's important to mention for all of these too that the onset of screening should be kind of a conversation and a shared decision-making process between the patient and their provider. So for cervical cancer, it's recommended to begin screening in women at age 21. So from 21 up to 29 years, a PAP test or a liquid-based cytology test or LBC is recommended every 3 years. And then in women ages 30 to 65 years, HPV and cytology co-testing is preferred every 5 years, or they can also do the PAP test or LBC. So the PAP test alone every 3 years. So we've reviewed the numbers in Michigan and the recommended target population that we need to reach with screening services. And now we're going to look at what kinds of interventions work to increase cancer screening. And a great resource for understanding this is the Community Guide, which is put together by the Community Preventative Services Task Force. So the Cancer Screening Report is what you're going to see on the screen here. And the task force was started by the U.S. Department of Health and Human Services in order to identify population health interventions that are scientifically proven to save lives, increase lifespan, and also to improve quality of life. So what they do in their reports is to provide recommendations and identify gaps in evidence to help inform decision-making of healthcare professionals and also population health managers. Recommendations made by the task force are based in systematic review of relevant scientific literature, including study strengths and limitations, and also the effectiveness of interventions. And then the task force also looked at how applicable interventions are to the wider, more diverse public, as well as the economic impact of certain approaches. So like I said, on this slide is a summary of the report by the task force called the Community Guide, and that's going to include specific recommendations to improve cancer screening rates. So what works to increase cancer screening? In the report here, evidence-based interventions are broken down into client and provider-oriented screening intervention strategies. So during our discussion today, we're going to be talking about patient reminders as one of those client-oriented strategies. So based on strong evidence reviewed by the task force, client reminders are recommended to increase screening for breast and cervical cancers, as well as screening for colorectal cancer with fecal occult blood testing, or FOBT. At the time of the original review, evidence wasn't strong enough to prove effectiveness of client reminders for other types of testing for colorectal cancer. So like we talked about before, the flexible sigmoidoscopy and colonoscopy. 2 additional studies were identified during the review period that used client reminders for tests other than FOBT, so the results on effectiveness were inconsistent, so it kind of remains that initial recommendation. There were 5 studies that found large improvements in CRC screenings when client reminders were added to other screening improvement interventions, and 4 studies from the original task force review found strong evidence of effectiveness when client reminders were implemented alone. For breast and cervical cancers, 4 additional studies for each showed that positive results for screening use were similar to the effective studies that were used for the original recommendation. And none of the studies that the task force reviewed found any harms associated with client reminders. And so now I'm going to go ahead and pass it off to Tisha, who's going to talk a little bit more about developing a client reminder system.
Thanks, Julie. We're going to talk a little bit about creating a system. And for those of you who may already have a process in place, you can gather some ideas on how to improve your reminder process. So when we're developing or reviewing client reminder systems, we want to dig down into these 5 questions. So one is what? What type of cancer screening do we want to remind our patients to have done? Or maybe what is one of our lowest cancer screening percentages that we have in our office that we want to improve on? Next would be the who. For this question, we're likely going to be working off of the screening guidelines. So men and women between the ages of 50 and 75, or maybe we're looking at women over the ages of 50, or for cervical cancer, we're going to look at women between the ages of 18 and 74. Thank you. There's evidence that suggests intervening with the most accessible patients to the least accessible patients can be successful. So meaning we're going to target those patients who first come in for regular checkups. Those are the ones that are frequently visiting the office. We then would target those patients to receive regular care for chronic conditions, so those that are coming in every 3 months or every 6 months. From there on, we're going to move on to those patients who come in only when they have a problem. And then patients who rarely come into the office but are still showing up as active in maybe your EHR or your practice management systems. So you're grabbing that low-hanging fruit at first. Then we're to the when. When do you want to start this initial reminder? Do you want to start it at maybe their 50th birthday, after you've discussed the screening with them at a visit, but before the actual test, or maybe when they've missed an appointment is an opportunity to remind them of any screening? You may have to remind patients quite a few times before they follow through on any recommended screening. I don't know if there's people on the call that have heard of the marketing rule of 7, but it basically says that a consumer needs to hear the advertiser's message at least 7 times before they're going to buy whatever the product is. So think about this rule and what we're creating or updating your reminder system in your office. Think about the frequency of how many times that patient needs to hear that reminder. And then we get to the where. Where are you looking to target patients while they're in the office, or do you want to bring the message to patients in their homes? Or thinking maybe of the marketing rule of 7. Do we want to target patients in both settings so they hear the message multiple times? Then we get to the how. Let's look at the types of reminders. What types of reminders in the office, or what type of reminders in the office are you able to use and sustain? So when we're also talking about the how, we're going to implement the reminders. We're going to be diving into the details of the timing and the types of reminders. Just like we just talked about, reminders can be untailored so that you're addressing the overall eligible patient population, like the patients that reach the age of 50 when screening is recommended, or those that can be targeted for individual patients. For example, a patient who is due or overdue for a screening. When we jump into the types of client reminders, so we have phone calls, mailed letters, postcards, using your EHR technology to create lists, and messaging through your patient portal, or maybe we have a fancy system and you can text message your patients. In addition, the most common type of reminder is the in-office reminders at the point of care. So on a side note, if we want the message to be most effective to our patients, we need to ask them what are their preferences for the mode of communication. So do they prefer a text message? Do they prefer a letter? Do they prefer a phone call? And then we want to document that in the chart so that we're consistently providing that message to them in the mode of communication that they prefer. So for over 2 decades, the evidence has shown that there's a recommendation when there's a recommendation from a doctor, it's the most powerful single factor in a patient's decision to be screened for cancer. So we need to ensure that it's not just the office staff that's reminding the patient of screening. We need to hit the patients with the reminders at multiple points throughout the visit. It's also been found that members of minority or low-income groups with less than formal education and older adults are less likely to be given a screening recommendation. So it's also important to devote our attention to screening and education to these groups. During the visit, it's important to assess the patient's risk status. So we need to talk to our patients about their personal needs. Is the reason that they're not getting screened because they need transportation? Are there financial worries about their screening? Are they apprehensive to get screened because they've heard someone had a bad experience? We need to talk through this with our patients, discuss other options that may be more suitable for their needs. If it's a colonoscopy they're nervous about, let's discuss at-home FOBT. Empower the patient with screening education and empower them to be part of a decision-making process. Also be sensitive to language barriers. MPRO, American Cancer Society, and NDHHS all have resources that can be translated for a multitude of language. It's wise to keep plenty of resources on hand in the office in multiple languages that are most prevalent in your office. So when we talk about the point of contact, there's a guideline to maneuver through some of those conversations with your patients. There's a guideline out to increase screening rates, a quality improvement toolkit for busy office practices. It was developed by the National Colorectal Roundtable, the American Cancer Society, and Thomas Jefferson University. And basically, it runs through the questions that you should be asking your patients. So if it's the first time they're going to be screened, talking to your patient, have you heard of a breast cancer screening, or asking them, have you heard of a mammogram? If they say yes, you can move on to the next question. If they say no, I'll review the stage 1, stage 2, and stage 3 guidelines on the next slide. So we can then ask the next one, are you thinking about having a mammogram? Well, the patient says, well, maybe. I don't know. I thought about it. Yes, you can go on. So which of the following best describes your thoughts? Are you thinking, I haven't decided yet? I've decided I'm not going to get one. Or, yep, I'm going to get a mammogram. For each of those responses, there's a guideline to how you can best respond. So if the patient has decided against screening, you can always provide the patient with education and handouts on the screening test, explain the procedure in detail, and then discuss the importance of them being screened. If they've heard of the testing but they're not considering it, ask the patient to voice their concerns. Once again, asking them, what are your apprehensions? What are you concerned about? Is it a possible bad experience that someone had? Or maybe you just have to I don't want to use the word debunk, but debunk some myths that maybe they've heard. If they've heard of the screening and they're considering it, give the patient a list of facilities where the patient can be screened. Offer to make the appointment for them. All right, that might be helpful. Give the patient a list of facilities where the patient or where they can be screened. Make the screening appointment for them before they even leave your office, and then make sure you track that appointment date and whether or not you've received the results. And then I'm going to pass it out over to Julie to discuss client reminders via mailed letters.
Yep, so Tisha just talked through kind of what the point of care reminders look like and talking with patients at the point of care. And another mode of client reminders that we've heard of a lot from our practices in the field is using mailed letters. So here on the left of the screen, we have a template letter from the American Cancer Society, and this is targeting patients at average risk for colorectal cancer. So it's a little bit too small for you to see on the left side of the screen, so we've pulled out some of the key components on the right side to kind of keep in mind as you're crafting a patient reminder letter. So first off is a statement of office commitment to health promotion. So basically letting the patient know that both their provider and the clinical office staff care about their current and future health. And then next is a statement about the patient being either due or overdue for screening, and then it has a prompt to call the office and schedule their test. Next is a summary of screening tests that are offered by the office. So in this sample here, American Cancer Society kind of summarizes all of the tests that can find polyps in cancer, but also you could, just include the tests that you are doing in office or providing to them or referring out to. And then at the end of this letter, it also includes a little note that there is an informational brochure included. So that's kind of something to think about too, along with that reminder letter, including a brochure or a handout. Maybe some information on screening criteria for that type of cancer, or maybe a summary of different screening tests for that cancer. So next up, for different types of client reminders, we have mailed postcards. So we've pulled a couple of samples just to show you today. There are two from the CDC, one on the left and right, and on the inside there in the middle is a sample from the American Cancer Society. So we like these ones because on the left from the CDC's Screen for Life campaign, this postcard includes some reasons from patients for why they're not sure if they need to be screened. So these are probably things that we're hearing from patients in those point of care contacts with them when we're initially talking about screening. So our guy on the left there is saying, I'm only 53, I'm too young to have screening for colorectal cancer. But in reality, we know that screening is recommended to begin at age 50. There's a woman on the postcard saying, I don't have symptoms, and we know that early on, many cases of CRC won't have symptoms. And then the woman in the bottom corner on the right is also saying, I'm unsure about that certain kind of test. And that's kind of a good opportunity to stimulate conversation with the provider that there are multiple kinds of tests that patients can use for CRC screening. So that's just going to be a personal conversation again. And then in the middle from American Cancer Society, this postcard is an example of a general reminder for patients who are turning 50. So like Tisha was talking about, another way that you can do client reminders as far as timing goes is sending out kind of a blanket, you're turning 50, you're now eligible for colorectal cancer screening, just as an example. And then at the top of that resource, it also gives visual cues. So there's a birthday cake with 50 candles on there telling them that they need to contact their doctor to go ahead and talk about screening. And then on the right, also from the CDC, is another version of a Screen for Life campaign postcard. And that, kind of like the one on the left, presents key information in a true-false format. So it lets patients know that CRC is a leading cause of cancer-related death. It affects both men and women. There may be no symptoms early on, and that the best way to stay healthy and have peace of mind is to get screened. So on the next slide here, we just have some similar examples from American Cancer Society related to cervical cancer and breast cancer. So with postcards, we've also heard through conversations with our partners that if they can be addressed to a patient from either their primary care provider or from their doctor's office, seeing a name that the patient recognizes on the postcard makes them more likely to stop and read through that a little bit more closely. So the American Cancer Society has postcards and other materials that can actually be co-branded with your practice's logo. So if you're interested in doing this, there's actually a license agreement that can be filled out. And if you have any questions, feel free to reach out to us with that, and we can help you with that process. So next, Tisha is going to talk a little bit more with us about client reminders and emails and messaging through the patient portal.
So being from a quality improvement organization, we want to make sure that we're aligning efforts. And the best way that we can do this is if we're actually going to be using client reminders through the portal, through the patient portal, We can also align this with any quality payment program or MIPS initiative. So by providing patient access, we're going to be able to provide them timely access to patient to view, online, download, or transmit health information. That's a QPP measure. And we'd also be able to allow them access to the patient portal. From there, that's going to give you points for QPP. So it's also going to allow us to communicate with the patient back and forth. So then we can provide them patient-specific education regarding cancer screenings, which is also going to account for you for QPP and MIPS. And then also if you're secure messaging the patient. So we're sending them that patient education, but then sending them a personal message. Hi, Jimmy Smith. This is Dr. So-and-so's office. It's time for your whatever screening. Please let us know how we can accommodate this. The patient then responds back, and you have the also secure messaging component for MIPS. Julie's going to talk a little bit about text messaging.
So patient reminders via text message isn't one of the interventions that's actually included in the task force recommendation. But we are hearing more from practices now that they're communicating with patients via text message. They can kind of reach patients where they are. They're not missing a phone call that might be at home. They're not losing any kind of mail. So we just kind of wanted to chat a little bit about patient reminders via text message. So in our review of the use of text messaging, we came up with a systematic review that was conducted in 2017 that kind of looked at the impact and reach of text messaging interventions on cancer screening. So we pulled out a couple of studies that were used in this systematic review and that use this intervention for the cancers that we're discussing today. So the first one is summarized on your slide here. It was published in 2016 and enrolled over 8,000 participants from 141 practices in London. And adults eligible for screening were randomized into a control group, which utilized the standard GFOBT screening pathway, and then the intervention group, which received usual care plus a text message reminder. So patients in the intervention group who hadn't returned their screening kits were sent a reminder text in the 8th week of an overall 18-week GFOBT screening episode. And the intent to treat analysis in the study showed that there was a 40% uptake in the control group and a 41% uptake in the intervention group. So no difference was found on effect of uptake by sex, indexed deprivation, age, or also practice health system. So overall, the study found that text message reminders did not significantly increase the number of patients adequately screened, though it did find a 6% difference in uptake that occurred in patients receiving this invitation for the first time. So it kind of suggests that maybe it's worth looking into for patients who are just kind of starting their screening journey for colorectal cancer. There's also another study on text message reminders for breast cancer screening. So this particular study was published in 2015, and it included over 2,000 female participants in a London borough receiving their first breast cancer screening invitation. So the control group received a normal cancer screening referral, and the intervention group received a normal invitation, again, plus that text message reminder 48 hours before their screening appointment. So from this study, the intent to treat analysis showed about 5% higher uptake in the intervention group compared to the control group. So it was about 64 versus 59% respectively. And the per protocol analysis showed about an 11% higher uptake in intervention versus control group. And both of those differences were statistically significant. So in summary here, the study found that sending women a text message reminder before their first routine breast cancer screening appointment significantly increased attendance in this team. So then to compare the effectiveness of different methods of recall for repeat pap smears in women who had previously had a normal test, this study summarized here looked at screening uptake percentages in women reminded via postal letter, text message, or phone call. So in this study, the per protocol analysis showed that those who received SMS, the text messages, had a 9.1 increase in absolute screening rate compared to those who received a letter containing the same information. and the intent to treat analysis showed about 20% higher relative screening rates. So since this study was only conducted in women who had a previously normal PAP, we just want to make a note that results aren't necessarily generalizable to women who are being screened for the first time. So I think that all of these studies kind of suggest that we might be onto something with using text messages for client reminders, although it does kind of differ for if that person is having that certain type of screening for the first time or if it's a repeat screening. So we'll be looking forward to kind of some more evidence on client reminders via text message. And then when we are talking about client reminders via text message, we were kind of curious about what sorts of things were being conveyed to patients in those text messages. So one study was using the following prompts. So there is a neutral message that you can send. So for example, your cervical smear test is due to book, please call, and then the office information. There are also a couple that utilize social norms. So the first one is to say, last year in this location, X number of women took part in cervical cancer screening, and then let them know that their cervical test is due, and then also that office information that they can call to book. Another kind of take on the social norms message would be, last year in this location, this number of women took part in cervical cancer screening, and your test is due, please call the office. And then also a couple of different kinds of messages were aimed at the patient receiving a gain and then a patient receiving a loss. So for the gain, the message could look something like, cervical cancer screening saves X number of lives in the U.S. every year. Let them know that they're due and prompt them to call the office. And then the perceived loss would be failing to attend cervical cancer screening could lead to X number of avoidable deaths in the U.S. every year, and also, again, let them know that their cervical cancer screening is due and to call the office. Now I'm going to pass it back over to Tisha again, who's going to talk more with us about best practices from the field related to client reminders.
So within the next couple of slides, we want to share with you some of the best practices that we've seen throughout our experience with working with practices out in the field. When we look at generating patient lists, we first think of those lists that we get from our insurance payers. So we get the list generated from our payers like DCN or HAP, Priority Health. Obviously, these are a great start when it comes to initiating a client reminder system. We know that there's a dollar amount to each of these patients that are compliant with the test, but let's really think about this. Is the real purpose that we're calling these patients to remind them that they're overdue for a screening is because we want the incentive, or is this the actual reason we got into this field? Because we care, and we want to help the patients, and we want to make a difference. So let's think about all the patients that we also have left out because we're only focusing on the patients that we get incentivized for from the health payers. We need to think about the patients that we have with Aetna's or the Medicare or Medicaid plans. Or those patients that possibly don't even have any insurance. We have missed all those patients by just focusing on the list that we get from the payers. So more than likely, we're not going to get a patient list from Medicare or Medicaid. So for those other patients that are being left out, that payer list reminder system, we'll then need to create our own list. So we may need to be generating this report from our EHR. If you have a friendly system, that's always possible. Or we may need to possibly resort back to an old patient registry, whether it's a system like Placentive, or we can even be gathering information in an Excel document. We will then use this tool to help reach out to those patients forgotten from those payer lists. We also need to remind them of the importance of being screened for breast, cervical, and colorectal cancers, much like those others. So you don't have any health information technology in your office? If you don't have health information technology in your office, have your patients fill out reminder cards or check out at checkout. You can then keep those cards and file them in a month or a year reminder divider. So you pull up the September reminders and you start your process of calling, mailing, texting, or messaging your patients through the portal. Even though you don't have technology, you still have the ability to have some type of tracking mechanism for client reminders. So whether we're pulling the information from our EHR registry or you've created your own patient reminder card system, it's important to maintain tracking forms. These forms need to include the patient name, the date of their last cancer screening, the date of and the type of screening reminder, and the date of the screening appointment. The tracker could also include any notes, such as Jimmy Smith is on vacation in Arizona for 3 weeks, call again in October. So any type of reminders that you need to remind yourself to make sure that patient receives any kind of reminder that they prefer. This tracking tool will also come in handy later on when Julie talks about measuring our progress and improving our screening rate outcomes. So another best practice from the field is making sure that we're engaging with care teams. So generating the reports using patient lists or even using a manual tracking system with patient cards is not a one-person job or something that can be done once or twice a year. This is a workflow process that needs to be embedded into our everyday routine. Everyone has a role. Everyone plays a part, from the front desk to the MA to the physician to maybe a care manager, an office manager, even to the checkout person. Everyone plays a part. And maybe it's not your MA that is sending the reminders or making phone calls, but they definitely are still playing that important role of getting that patient informed about upcoming or overdue screenings. That MA might have the important role of those point of contact reminders. So there's quite a few roles involved in the process, and this doesn't mean a person can't have more than one role. You may have one performing multiple roles, but there still needs to be another person involved in the process that's the champion. So by defining a champion, this person will be someone that oversees the process and all the moving parts. They're setting the deadlines, reviewing the workflow, and addressing any barriers or challenges within the process. And they're ensuring that the reports and lists are generated timely, whether it's a monthly or a bi-monthly or quarterly timing, and making sure everyone is playing their part in this process. There are proven benefits from using client reminders that are combined with other approaches to increase cancer screening. And in the next slide, we'll see an example of this multiple approach. So I wanted to share with you a sample workflow of a client reminder system that involves a multi-intervention approach. This practice has exceptional screening rates and is still interested in improving their rates. They're actually working with MPRO currently to help get reminders out to their patients using their patient portal. So this is just one example within their office, and this is for their colorectal cancer screening. And you'll see from the very first point of contact with the patient, they're starting the process. So at the point of contact, when that patient is with the MA, within their EMR, within the health maintenance section, they're receiving those alerts, so CDS alerts, indicating that patient is due for colorectal cancer screening. Right then and there, in the room, the MA completes the order for the actual testing. The testing is then faxed automatically through their system to the Center for Digestive Health. The order is faxed to them, and within 24 hours of the center receiving that fax or that order, CDH is then on the phone scheduling the appointment with the patient. If at any time the patient is non-responsive, CDH then calls the practice staff to let them know that they have not been able to contact the patient. The practice is then back on the phone contacting the patient to find out why. What's going on? Maybe the patient says, you know what, I had my colonoscopy last time. It was an experience I want to go through again. So then maybe we're going to offer them a different option. And then that MA or whoever answers the phone or whoever's making that phone call can then mail the patient a test. From this point, the practice also has the opportunity to pull or generate a report from their EMR. They can pull all the orders within their system that have not been closed. So finding any of those loopholes or finding any patients that may have not scheduled an appointment or they haven't received results on, they can pull a report for additional follow-up calls. So this is just multiple ways of different client reminders, getting other organizations involved to help the patients with their screening testing and to help improve screening rates. So from here, I actually want to pass it on over to Julie, who's going to talk about monitoring your progress. So now that you have a system in place, how's the best approach to ensure better outcomes?
Yeah, thanks. So we've talked through quite a few different modes for patient reminders for cancer screening, and Tisha kind of gave a great overview of putting that system into place. So now what we want to do is talk about monitoring progress. So we want to see how the interventions that we are putting into place are moving our numbers. We want to know that this intervention is actually working for our practice. So one of the ways that we can do that is to utilize a rapid quality improvement cycle, something like the PDSA cycle. So first, before we get into the first step, which is plan, what we want to do is establish a baseline by identifying percentages of your patient population with completed screening tests for breast, cervical, colorectal cancer, whatever cancer that you are interested in improving. And then the first step in this cycle is plan. So talk with your care team about what's working well for screening, maybe any common barriers, and what could be done differently. Also identify specific improvements that the team wants to make. That might mean setting a goal percentage as well. And then talk about any additional support that might be needed. So if you have the tools currently on hand that you need to go ahead and implement this process. And then establish which care team members are going to be involved and what patients to target, and then how you will reach them. So then the next step in the cycle is do. So go ahead and implement your intervention and ensure that all responsible staff are engaged and have the support that they need throughout the intervention time period. After you implement the intervention, the next step is to study. So after your defined time period, pull the care team back together and revisit your screening rate. And talk about what's working and what might need to be changed about the intervention. And then also don't forget to take into account the qualitative results too. So we're talking a lot about monitoring the percentages, but also kind of get feedback from the care team about those personal stories, about navigating a patient who was resistant at first to cancer screenings. Also if there are any patient stories about, a screening experience that went right for them. And then the next step is to act. So based on the conversations with your team, decide what can be adjusted about the current intervention, or if you would like to add an additional activity based on what you've learned. So especially for new interventions, it's important to monitor how activities are moving or maybe are not moving the numbers. So kind of in with the measuring quality improvement and provider assessment and feedback, one of the ways that MPRO is monitoring screening percentages with practice quarterly is through benchmark reports. So these reports, and we have a little screen capture for you in the bottom left corner of what that report looks like. Progress is being charted on the provider, practice, and all project participant levels. And then also moving forward, we're going to be incorporating national benchmark percentages as well, so that practices can use this and target percentages for goal setting. So kind of a throwback to the community guide that we were talking about earlier as well. In the top right of the screen is another screen capture from the community guide, and this time this table here is summarizing the provider-oriented, evidence-based interventions that work to increase cancer screening, and provider assessment and feedback, like we were talking about with MPRO's benchmark report. That is one of the evidence-based interventions. And so now I'm going to go ahead and pass it along to Elise to discuss some more resources with you.
Thanks, Julie. All right, so if you are interested in accessing any of the resources we've provided in our webinar today, we've actually included a couple of links that you can go ahead and look at. So the American Cancer Society has a lot of general cancer information that you can give to patients. And if you saw anything such as the postcards that we had in our webinar, just go ahead and contact Julie or Tisha, and we can talk to you about how to access more customizable things such as the postcards. The Screen for Life campaign, you also saw some postcards from them in our presentation, but they also have a really helpful toolkit that includes infographics, fact sheets, posters, postcards, and more, and so the link is there for that. And then the Michigan Department of Health and Human Services has fact sheets for all of the cancers that we discussed. So this is just an example to the right, the colorectal cancer fact sheet, but there's also one for breast and for cervical cancer. And then last but not least, this is another really great resource to use called Make It Your Own, or MPRO. And this allows you to really customize any of your health content. It's free to use. All you have to do is register with an email. And they have a variety of health topics to choose from beyond what we've discussed today. And they also have postcards, flyers, posters, and more. So these are just some examples. And if you just Google search Make It Your Own or MPRO, it'll pop right up that first one. So with that, I would like to end our webinar by thanking Julie and Tisha for presenting today. So at this time, we'd like to make the evaluation questions available to all attendees. Please take a moment and let us know your thoughts on today's session. We do use participant feedback from these evaluations in the planning of future learning sessions. Also, we'd like to open the line for any questions or, like we said earlier, any feedback that you might have so that Julie and Tisha can address all of those.
Ladies and gentlemen, if you have any questions at this time, please press the number 1 key. Again, if you have any questions at this time, please press the number 1 key. And I'm waiting for callers to join the queue. We don't have anyone in the queue at this present time.
All right, thank you. All right, so again, thank you, Julie and Tisha, for taking the time to speak with us today, and thank you to all of our attendees for joining us as well. The slides from today's presentation will be available on MPRO's website and the YouTube channel within the next week. So this concludes our session for today. Thank you for joining us, and have a great day.
I would like to say thank you, ladies and gentlemen, for joining me. I'll disconnect. Have a great weekend and great day as well. Thank you.